job with them. I went hiking with some friends, with my roommate and a couple of friends, and I slipped. It was the Billy Goat Trail in between Virginia and Maryland. It's a very steep trail, something that I enjoyed to do on my free time to kind of blow off some steam. I slipped. I hurt my ankle and my knee. Um, you know, it was something that would have required surgery that I never ended up getting surgery for. But I went into the urgent care in Maryland, and the doctor prescribed me hydromorphone, which is Dilaudid. It's a high grade opioid. Um, I took that hydromorphone. I was recommended that I would get an MRI. Never got that MRI. Just kind of walked it off and went back for more hydromorphone and got another prescription and more and more and more. It didn't really cross into a problem for me until I had moved back to Florida, which is where I'm originally from. I was living in DC. After the election, had moved back to Florida. Started to experience some difficulty with my ankle as a result of never really getting it checked out. Went to my primary care. My primary care said, we understand you have pain. We understand you really don't have time to get surgery. We can just kind of patch this up for right now. And why don't you go see this pain specialist? If you know anything about South Florida, I write about it in detail in my book. If you know anything about South Florida in the mid-2000s, that was pretty much the birthplace of the pill mill epidemic, which existed before the opioid epidemic. There were pain clinics being set up on, it seemed like, every single street corner. They called it the Oxycontin Express. People were coming down. All the opioids that were in Kentucky were originally coming from Florida. They had a pipeline into Kentucky. These are all things that I've learned now, by the way. I didn't know it when I was down there. So I go into this office, very casual, normal doctor's office, doctor with a white coat, lay out my ailments to them, tell them what's going on. The very first thing I get is this ridiculous, now what I know to be ridiculously large quantity of Oxycontin and oxycodone and other substances that came with it. And I started taking them. It was a pill bottle with my name on it. As naive as it sounds, I did not put the connection between having an addiction and getting these medications. I was working. I was, really finding my own groove. I had opened up my own consultancy business, had a car, had an apartment, had a dog. I mean, everything. Family life was good. I had just turned 24 years old, and I was kind of on the rise with my career. But I went in and I got this prescription for pills. When I first took those, that set of medication, the Oxycontin, did something different that the hydromorphone did for me. It's people ask me all the time, what did it feel like? I was not the type of person who was addicted who nodded out. Those first several months, I got an incredible boost of energy. I had suffered some childhood depression. I was still having it into those years, early years of my 20s. All of that went away. I had overperformed at work. I was writing a lot. Certainly wasn't experiencing the negative consequences yet. But what started happening was I started using my medication more and more and more and became more heavily dependent on it. And that kind of went over the span of 2 years. It did eventually turn into drug seeking, where I started seeing the doctor more regularly. When my doctor was unable to prescribe me more legally, I was referred to another doctor. The doctor I was actually seeing at the time was using the medication too, and said, hey, go see this doctor. There was no PDMPs in place. If you know anything about a PDMP, it's a physician's database. It's very common nowadays. I believe all 50 states have it, or close to all 50 states have it, but it's a prescription monitoring database. We didn't have it back then, so I was seeing multiple doctors. I knew at this point that I was doing something wrong, but I also had started experiencing the the withdrawals that come with when I stopped taking my medication. The first time I knew I had a problem, I was sitting at my desk, much like I am right now. I was doing work. I had run out of my medication the night before. I had said, okay, that's all right. I'll call the doctor tomorrow. I'll find a way to get some. So I'm not going to run out. I knew that I started to feel a little woozy. This was the first time where I really let a significant gap of time go between me and my meds. I didn't make it to the doctor's office that day. Next morning, I went into work. I felt deathly ill. What I was experiencing was withdrawal from opioids. I had Googled side effects of OxyContin. I knew that there was some stuff that was going on there. I did not know how serious it was. I went into the bathroom, put some water on my face, and I said, "Oh my God, like is this connected? Is this because of my meds and I'm not taking my meds? And like, am I dependent on my meds?" And my first thought at that moment wasn't, I have a problem. Let me get help. It was, how do I get more meds? For several months after that, things started to go on a downward slope very quickly. Fast forward, 2 or 3 years later, I had pretty much wrecked everything. I was in and out of apartments, couch surfing, lost multiple jobs, got multiple jobs, bouts of homelessness. My mom, who is a saint, my mom, saved me, not in the sense where she came and rescued me, although she did do that multiple times. Helped me get into treatment a few times. It didn't stick, but even when I was, she was no doormat. She knew not to let me in the house. She knew not to give me money. But she always called me, checked in on me. Hey, are you okay? Do you need some food? She would come, she used to make these Tupperware meals for me. And I mean, if I was on the street, she would bring them to me on the street. She would hang them on hotel doorknobs that she knew that I would be staying at. I was still invited, we would have kind of a standing invitation, although I didn't make it many times while I was in active addiction, but it was always kind of like every other Friday, we'd go see a movie or something like that. No matter how loaded I was or what was going on with me, we had kept that type of connection. I eventually made it into a public treatment facility in Florida, put a little bit of sober time together, but never really had a good indoctrination into recovery. Had always just kind of gone in and out of 12-step meetings. What ended up happening this time, because this could be a very long story, was in 2014. I was in California. I had a job out here, lost everything, back at the bottom again, had been using for about a year, really had a very, very quick trip to the bottom. Could have died multiple times easily. Couldn't get into treatment. Ended up getting my name onto a bunch of lists. Waited, multiple weeks to get into treatment. Got into a public detox. After 6 days of detox, or 5 or 6 days of detox, I thought I was going to get longer term care. And they were like, "We don't have a bed for you," and kicked me back out on the street when I was still kicking. And by an extraordinary stroke of luck, and my mom, who had been making calls, I got into a treatment center that basically let me go there for nothing. There was a little bit of money involved to pay for medication and some of my my material expenses, but it wasn't, anywhere near what the cost of it was. And I stayed there. I did 9 weeks, and I, December 2014, there was a moment, I had been to, I am a big supporter of all pathways to recovery. I was in an abstinence-based program. But there was a moment in December of 2014 where had been there for 3 weeks. I couldn't get the noise out of my head. I couldn't get the cravings out of my head. I wanted to use really bad. I was about to bolt out the door, and I was put on medication, assisted treatment, which is also known as Suboxone. I was kept on it for the duration of my treatment, stay there for about 10 or 11 weeks. So it was a short-term treatment. Got out of treatment, immediately went into a recovery residence. And that's really where my life got saved, I think. I plugged in with a really good peer group, um, found my pack, got into a stable recovery residence, found a job, never wanted to talk about my experience of addiction again. My mom never wanted to talk about it. My family wanted to forget about it, just sweep it under the rug. But we couldn't do that. You know, the difference between the other times and this time was, you know, about 8 months into my recovery, I lost three really good friends in about two and a half week span. All happened like at month 8 for some reason. Roommates of mine died of overdoses. Then I lost a fourth. Happened all very quickly, and then it just seemed like every single month there was another one and another one and another one. You know, what are we? We're in August of 2018. So as of this month, it's 21 is the number. You know, it's crazy. And this switch went off inside of me, and it was like, what? This isn't okay. Like nothing about this is okay. You know, this is not cool. You know, I can't just sit here. I need to focus on myself, but I just didn't feel right. I didn't feel right being quiet about it. I was terrified. I didn't know what to do. And so I just started connecting with people. You know, I got out of my comfort zone, traveled the country. You know, I started to meet other people in recovery that were active and doing advocacy and being public about their recovery status. I started connecting with parents who were public about it. And I found this space where not only have I gotten, you know, involved with activism, but I've started to create a very high level of personal accountability for myself. You know, people ask me all the time, like, isn't it dangerous, you know, doing what you're doing, advocacy and whatnot? And I say, no, it's not, you know, because I maintain my own personal recovery, which is not public, which I really don't talk about too much because of it's just my own personal choice. But through my public activism, I've created this space of personal accountability for myself, and I'm grateful for it. But the short answer to your question was there was a tremendous amount of luck that was involved this time. It's not because systems were set up for me to succeed. That's for sure.
Yeah, I'm really hearing that. And that's unfortunately a really shared experience out here, as you know. And I just want to say, gosh, I sympathize with your losses. It's a lot. So, Ryan, what do you? I hear that, you know, I've heard it's such a mystery why people finally choose, like, what is their rock bottom, that some people don't have a rock bottom, but that it's a mystery, really, sometimes that shift. And what I heard you describing, a very clear shift, that through all these losses, and that it was just, you were just moved, that it was not okay with you. So what, is there anything else that propels you to just move forward? And what are you experiencing in this movement that you've joined? What's happening for you?
I think, you know, at the crux of my recovery, I believe that all my life, you know, there was a reason that I used. I don't like to internalize it too much because it's old news. But there was a feeling I got from it, and there was something that was going on inside of me. You know, now almost 4 years in, I think that what I've been searching for my entire life that I found are two key ingredients that I think are a must for anyone's sustainable recovery, and that's community and purpose, right? So my purpose, and through my purpose, I found my voice. And then through those things, I've built self-esteem. I've built accountability. I've built trust. My life is vastly different from what it was 4 years ago, not materialistically, in the way that I look at things, view things, perceive things, talk to people, treat people. A lot of that is because of my personal recovery program, but it's because I found a community that welcomed me and accepted me for who I was, and I found something to wake up for in the morning.
Mm-hmm.
Right. And I think that's something that a lot of, I work with a lot of guys who are looking for recovery, or trying to maintain their recovery, or just entering recovery. So I just wrote a book. I mean, that's out there, right? I'm not lying to you when I tell you 4 years ago, I couldn't get a job. Nobody would hire me. Nobody, like, the best thing I could do was drive Uber. I could not get someone to employ me. People in recovery, we need more than just 12-step meetings, right? We need healthcare. We need stable housing. We need to be employed. We need to be welcomed back and reintegrated into society. We need to be welcomed. We need to not be shamed. I did a lot of bad stuff when I was using, stuff that I am not happy about. But that's not who I was. I mean, when you understand the disease, and when you understand what happens to the brain when you're using a substance such as like heroin or opioids, that's not my brain. That is a completely hijacked survival, fight or flight mode of my brain. You might as well put a 900-pound tiger in front of me, and I'll do anything to starve off that tiger, to fight off that tiger. That's what's going on to your brain in addiction. One of my best friends put him on a plane this morning to go to treatment in Virginia. One of the nicest guys in the world. I mean, just a sweetheart. He's a good son when he's sober. He's got a huge heart. Couldn't stop using heroin. He's making some really bad decisions. I found myself, answering that call and talking to him and having these long conversations with him. And I'd start to get really frustrated because as people do really crappy things when they're using, and they say things that they don't mean. And I had to disconnect for a second and just put myself back to where I was. That's not my buddy talking. Like, that is not him. I mean, like, I know him really well. I know his family. I know where he comes from. I've been with him when he has been sober for very long periods of time. That's not him. That's that fight or flight stuff going on. But I also know he never really had a good shot at treatment. Here's a kid, he's 27 years old. He's been to probably 4 treatment centers, had been put through kind of this revolving door of a 30-day, spin cycle, where his mom, God bless her, has probably opened multiple credit cards and mortgages and whatnot to send him to all these, 5-star treatment centers. Treatment, the way treatment is set up right now in this country is it's really just detox. It is impossible. I'm not going to say you might. It's impossible to treat a chronic illness in 30 days. Mm-hmm. Mm-hmm. You can't treat any chronic illness in 30 days. Nothing. Heart disease, cancer, diabetes, nothing. You can't treat any of that for 30 days. So the same applies to addiction. He's going to a place though and these places exist and they're all over the country. And I'm glad I've learned so much about this the last couple of years. It's going to what's called a recovery community organization in Richmond, Virginia. It's the McShin Foundation. It's a nonprofit. They do the 30-day kind of treatment model, give you some new life skills, teach you about the disease. You have groups, you start to meet some other people that are like you, get some individual counseling, get your brain right. But then you go into more of this longer term care model where you're getting, stable recovery housing, you're getting outpatient, they're helping you find a job. If you need a GED, they're helping you find, if you want to get your GED, they help you get that. They do some vocational training with you. they really try and hold on to you for a year, which is kind of a good, I would say for me, it was a year to 18 months, which is, I mean, my brain really started to come back after a year. After about 18 months, I started to be myself again. You need a year, you need 18 months. And I tell parents all the time, for the cost of sending your kid to addiction treatment, some of these places, $15,000, $20,000, $30,000 a month, you could get 18 months to 2 years of care for that. You could send them to a good detox facility for 3 weeks for, 6 or 7. That would be your highest cost, $6,000 or $7,000, and then get them some stable recovery housing, sober, aka sober living. Get them into sober living for $700-800 a month. Get them some health care, $200-250 a month. Through that health care, they can get a sober coach, see a doctor. There's a way to, in the current broken system, to kind of build your own continuum. And I've seen the best outcomes, and that's my story. I've seen the best outcomes when people do that.
Mm-hmm. So that's the thing. Like, we all want to grab onto that and have our loved ones stay in these programs. And for me, I just wonder, are there even enough of these recovery community organizations? Where are they? How do we find them if we Google them? And then how do we get our loved ones to stay there?
So bring up an interesting point. There is no guarantee that anybody's going to stay anywhere, including myself. And I the other day I said that on a thing I did, I think on Facebook, and my mom was watching. I don't know if Cheryl's on, but I did a Facebook Live with Cheryl about this Purdue Pharma March we're doing on Friday. And I had made a passing mention that there's no guarantees, for tomorrow for me. It's today, and I focus on today, and I stay in today. But part of the reason I fight and I do what I do is I may need treatment again one day. I don't know. Mm-hmm. I certainly hope not. I've worked very hard at hoping that doesn't happen, but it's a possibility, and it's a reality. Mm-hmm. Addiction is a recurring, relapsing, chronic health condition, and you never know. But you have your best chance. There's some data and science to back this up. I'm about to go into year 4. After year 5, if you can get someone past 5 years, if you can get past that 5-year mark, United States Surgeon General's report of 2016 on alcohol, drugs, and health, which spent years studying this, says that you've got an 85% chance at lifelong sustained recovery. Yes. So we have an 85% shot. I have an 85% shot at this after year 5. So the big question is, why aren't we focusing on 1 to 5? Why are we dealing with this in a chronic, why are we treating this in an acute kind of ambulatory phase and not looking at the chronic condition? Recovery community organizations are our best hope at that, in my opinion, right now, unless the big insurance companies make some serious changes. It is almost impossible to get care for that long for addiction under the current insurance model and reimbursement rates. People just can't keep the doors open because insurance companies won't pay. Mm-hmm. You're not going to necessarily find them on Google. There's an organization called the ARCO, the Association of Recovery Community Organizations, ARCO. Google that, and it'll bring you to their website, and it's got all the RCOs state by state. They're really good spots to look into. They don't want anything from you except for you to get better. Anybody can walk in off the street and say, I need help, and usually they'll find you what you're looking for depending on what your need is. And then when you're done with treatment, if you do treatment or if you decide not to do treatment, they've got the resources there, and they're there to help you. I like to send people to RCOs versus treatment these days. Now, that being said, treatment did save my life. I mean, if you can afford to go to treatment, if you can find treatment, definitely, take an opportunity. It's not a 30-day fix. There's no such thing.
Yeah. Well, so I know in Arizona, I'm in Arizona, and Arizona, it's a really big secret, but there's a federal grant that will see people through longer term treatment, detox to treatment and beyond. But these are the secrets that the general public aren't aware of.
Mhm.
But there's two quick questions, and then I'd love to hear about more about the march, more about your book. But the two questions are: someone's curious about how long you stayed on Suboxone, and another, was there any jail time that you experienced?
Sure. So the Suboxone question, I'm not a doctor, and it varies. It depends on the person. It depends on how long they've been using. It depends on their situation. It depends on their access to resources. I have friends of mine that have been on Suboxone for years, and they're living very full, purposeful lives in recovery. And recovery for me is not a measure of whether or not you're on Suboxone. It's a quality of life measurement, right? So where are you today versus where you were when you started? And I know some people who do very, very well on it. Some people like me have no business being on it forever. And it was a very quick, 9-10 weeks for me is what it was. Some people, only use it for detox. Some people, that's all they've got access to, That being said, Suboxone should never be prescribed without behavioral health care services, wraparound behavioral health care services, or peer supports. You cannot, it is not a silver bullet, and it was never intended to be a silver bullet when it first came to market. It is a medication that assists treatment, and it assists recovery. It is not by itself recovery or treatment. If someone is on Suboxone, there should be a protocol for therapy. They should still be plugging into some sort of recovery protocol, whether it be meetings or peer supports or sober coaching or whatever it is. There should be other things that go with it. There is a very high diversion rate for Suboxone because it is an opioid also with an antagonist. That does not make the medication an evil thing, though. It saves a lot of lives, and I've seen it save a lot of lives. But it has to be done right. And I would say if anybody's looking to do it or is on it, make sure you do some research on the prescriber, because the prescriber is really a big deal. You need a prescriber, a doctor who really understands addiction, who is an addictionologist, who isn't just some former pill mill doctor that's now gone into the business of buprenorphine. We're seeing a lot of that. It can be very, very effective, but the time really, really varies on the patient. And then your second question, because there was a follow-up to that, is about jail. Yeah. No, I've never spent any significant time in jail. I mean, I've been in and out of, jail for various reasons, but a night was the most. I'd never been really locked up or through the criminal justice system. I probably should have at some point in my addiction, but I was not. But we are seeing a paradigm shift in certain areas, certain geographies on how they're dealing with addiction in jail. I've spent a lot of time in recovery working with jails. One specific one is the Chesterfield County Jail in Chesterfield, Virginia. It's a pilot program called the HARP program, HARP, Heroin Addiction Recovery Program. It's absolutely fascinating. I write about it in the book. I, quite frankly, would have rather gone to that jail for their program than to the treatment I went to. People are getting detoxed on the spot. They're given peer supports. They're training people for jobs while they're in jail. They're making sure that they've got housing when they get out. It's a very progressive sheriff who was sick and tired of getting people sober and detoxing them in jail, sending them back out. And then they were coming back to him weeks later with new charges. that were related to their substance use, or they were dying. And he said something had to change, so he kind of turned up the jail up on its head, brought in clinical supports, started to educate himself, and is trying to treat it, as soon as it walks into his cell.
Mm-hmm. Yeah, that's a big worry. Like, not only what do we do for our loved ones to get into treatment, but what do we do for them after they have a record? So a lot of the people that are on this call and who will be listening to this call are parents of children. And I'm involved with a group called Family Recovery Resources, and we practice the BALM, Be a Loving Mirror method. And it's really that family is one of the most powerful influences for their children to choose recovery and maintain recovery. And that starts with us as families. So my whole intention and why I was so excited to speak with you is because you have spearheaded such a powerful movement in what we can do to change this epidemic. And I'd love to hear more about what you're doing and how we can join you and support you to support us.
I think, one of the gaps that I saw early on was civic engagement around the opioid crisis, around addiction as a political issue. And I know that sounds awkward to some people, but it is. My recovery, my personal recovery, is not political at all. It's mine. It's personal, and it requires a lot of work. But access to recovery, access to treatment, equality, pride, recovery pride. I mean, these are all things that have a real nexus in politics. And I think, I had about 2 years ago really started studying more. I'd known a lot, as a student and earlier in my life, but more about kind of like the evolution of movements, the different phases that they've gone through. And we have far surpassed, I think, the awareness phase. I think that awareness is heightened. I think that, we're at that point where everybody knows somebody. People are starting to come out of the closet, for lack of a better term, about their own experience with addiction, whether it's a parent, a person who's impacted, someone who's lost a loved one. And now people are moving into that what can I do phase. And so it's really about organizing and mobilizing. And at its crux, it's a community organizing model. We unfortunately live in a society where the majority of the people who are making decisions about us are doing it without us, and are not educated on addiction, aren't educated on what's happening in their communities, are so far disconnected from the reality of the crisis that we have to unite, right? We have to work together. Mm-hmm. I was pleasantly surprised when I had contacted my congressperson for the first time with some issues that were happening around this cause here locally. Was very persistent about getting a meeting, brought them to her attention, and she just openly admitted she had no idea. She didn't even know what I was talking about. And I said, well, really what's happening is you're losing, 2 or 3 constituents a week who are dying of overdoses, which are basically preventable. I mean, they're preventable. I mean, the bottom line is they're preventable overdoses because, yes, they overdosed. Yes, they took a pill or did heroin or whatever. But the circumstances of how they overdosed, it was a preventable situation. People dying in sober living homes, people dying in treatment centers, people not getting access to quality care, fraud, abuse, all that stuff. And she said, okay, well, why don't we craft some legislation together? Why don't we sit down and I had never written anything substantial in terms of legislation, but I did have a tremendous amount of lived experience to bring to the table. That lived experience is really powerful. Every single person has a very unique story that is of incredible use to your policymaker. The argument can be made, and we've seen some studies from the University of Pennsylvania. Pew Research did one right after the election. And there's not enough talk about it, I don't think. But President Trump won, I believe, single-handedly because of this issue. If you look at the counties where he surprised and shocked the world that took him over the top in those 3 swing states, they were Midwestern states that had overperformed in terms of turnout and went solidly for him. And these were people that weren't on the map at all in terms of all the predictor models. These were the counties that had the highest overdose deaths, highest rates of despair deaths. These were people that were suffering and had lost loved ones to addiction. And he spoke loudly and clearly to them in terms of building a wall. It was a message that resonated with these people. Keep the drugs out of our country. That was his message. Now, personally, at the time, did I agree with it? No, I didn't. I mean, like, I'm, full disclosure, I write about it. I'm a Democrat. I was a Hillary delegate, all that stuff. But he communicated his message very well to those voters, and they voted for him. So there's a political case that I think whoever champions this cause gets votes, much along the lines of how the AARP is a single issue organization, or the NRA, or the National Organization for Women, or the Brady, the Brady Organization on Gun Rights. I mean, these are all single issue organizations that are very powerful lobbies. We, as family members and as people in recovery and people impacted, outnumber all of them when we're organized. I mean, like, the numbers and the math are in our favor. I mean, 1 in 3 households impacted by addiction, 23 million people living in long-term recovery, another 21 million people who are currently suffering. That's 45 million Americans that are directly impacted. Mm-hmm. That's not to include the moms and the dads and the employers and whatnot. We're nearing $1 trillion economic impact. How could we not organize? How could we not organize if we know what to do, right? So you and the people who are listening to this call have been through the ringer on this. We know kind of what works. We know what hasn't worked. And we sit here scratching our heads while we're like, why is all this money being poured into a system that we know is broken? How do you change that? Well, you get involved. You register to vote. You knock on your legislators' doors. You tell them what's worked for you. You tell them what hasn't worked. You tell them what's broken. You give them whatever solutions, no matter how stupid you may think they are at the time, which I find myself all the time, this sounds like a crazy idea, tax breaks for, I've got a new, tax breaks for businesses that help pay for addiction treatment for people who can't afford it. But those are the types of solutions we need. Mm-hmm. We can't wait. We can't wait for other people to make decisions about us anymore, because when we wait for other people, right. Right. They make bad decisions, first of all, or they don't make them at all, and they do nothing. So I think that moment has come, and I wish I had better news, but the way that this crisis is evolving, it is not getting any better anytime soon. It is only getting worse. There's some predictors, some very, trusted predictors out there that show that if we don't do something drastic, we're looking at upwards of 500,000 American lives dead just from opioids within the next 10 years. Yeah. These are catastrophic numbers. Yeah. It requires a catastrophic, radical response. And we just got to jump in and do it. We all have to lean in and do our part.
So today I just got a petition. I got a request from your organization, Facing Addiction, that to contact by phone Senator Mitchell for the RS6 legislation. Okay. And I did make the phone call, but the message box was full. So I sent an email and then asked some people in our Facebook group, Loving Your Child Through Their Addiction, to also do that. So that's one thing. And just how do we, I'm somewhat taken aback sometimes that there's millions and millions of people involved with this who are hurting and suffering, but feeling very disempowered. And we're inviting people to sign these petitions, to make phone calls, to write emails, to go to marches, to go knock on the door. But what are you finding that's the most effective to inspire and motivate?
The number one thing, and it is incredibly simple. You may not, it may not be in your DNA to grab a clipboard and knock on doors and write legislation. For some of us, it is. It has been an evolving process for me to get to this point. The most powerful thing you can do is tell your story. The most powerful thing you can do is to just check that shame at the door and to let people know what you've experienced. Not be ashamed of it, because I'll tell you, the first time I told my story publicly, May of 2016, I had been working for Facing Addiction for a couple months. I decided to like do this grandiose op-ed and get involved in the national conventions that summer, but people didn't know my story yet. And so I said, okay, I'm going to write it, because that's where I'm most comfortable is writing it. And I'm going to see if anybody wants to publish it. I was mortified. I was terrified. I was outing myself. There was a certain sense of relief that I felt that I was finally doing it. I did not know how people were going to respond. The moment that it got published, I can't tell. I mean, I overwhelmed with the amount of messages and calls and people that I had known for years who were like, yeah, me too. I'm in recovery, or my kid is struggling, people I'd gone to high school with. And there was this immediate connection. And I just kind of inadvertently gave permission to another person to tell their story. And it really was this domino effect that led me personally on this journey of okay, well, what's next? What do I do next? How can I now get more involved? And it all started with telling my story. So if you're at that kind of in that ladder of engagement, that ladder of advocacy, and you're interested in this, the very first thing to do is tell your story. Share it with somebody. I promise you, not 99%, but 100% after you're done, you're going to ask yourself the same question all of us have, which is, what do I do next? And it will lead you down this road that who knows where you'll end up at the end of it, or if it'll ever end.
Would you say, Ryan, that that's applicable to family members?
100%. Yep. My mom, exact same experience. My sister, same experience. Other family members that I've met, absolutely. If you are a loved one in family recovery, or you're struggling, sharing your story is the most. I use the word weaponize. I mean, and that's kind of what we're doing now. Is we're weaponizing our stories for good, for social impact. All of the bad policy, all of the bad decisions, all of the shoddy treatment and the fraud and the abuse and the neglect and the no standards of care and this revolving cycle of a 28-day model that doesn't even have any science behind it. I mean, all of this stuff is a direct result of us being looked at as second class, less than, not worthy people. I was treated as a commodity because I wasn't viewed as a human, right? That all changes when people realize that they know us. I'm also a gay man. So I look at this in the verticals of the LGBT movement, which I've studied a lot. Gay people and people living with HIV and AIDS were viewed the exact same way at one point in our history. 80s, 90s, early 2000s, they were shunned, they were stigmatized, they were treated as second-class citizens, they weren't welcomed in certain facilities, they were denied health care, they were shamed, they were all sorts of terrible, horrible things. Fast forward to 2013, huge movements erupted. People are telling their stories. There's become this pride. Family members are coming out and talking about how much they love their gay kids. this tremendous amount of empathy and support. This country went from, even as late as 2004, I think it was 37% of Americans in 2004 believed that gay marriage should be the law of the land, and that it was actually okay. Fast forward to 2018, we're way above 80% now. Like we have surpassed 80%, where people believe that is human. It is a human right. That is their right. That they are normal. That they're just like me and you, right? That same shift needs to happen with people and family members who are struggling, who are in addiction. We aren't given those same types of opportunities. We're getting, we're treated second class because people see us as second class. That changes when you tell your story, though. That changes when you say, no, I'm going to be open about who I am and what my struggles are and the path that I'm on, and not be ashamed.
Say there are more effective or more appropriate places where we can tell our story and have more of an impact?
Sure. I mean, it all depends on where you are in your journey. I suggest sharing it at first with if you're just starting, share it with a trusted friend, a loved one, family member. Just to start to there's a huge relief. I know that happens when you do that. That you're not alone anymore, and you're not alone. Make sure you're plugged into your support group, because family recovery support groups are so important. For me, there's no way I would have ever, grabbed a microphone and told my story for the first time from a stage with 20,000 people. It's just not my style. It wasn't my style at the time. For me, it was pen and paper. I sat down in a very controlled environment. I sat down and I wrote it. I shared it with some people first, and then I submitted it as an op-ed. And it seems like these chains just kind of broke off right after that. I'm grateful. It was the right move. And for every person that I know, my friends, family member, community, anybody who's done it has had the exact same experience. It has made a tremendous impact in their recovery as a person in recovery or as a family member in recovery.
Yeah. It's interesting because I talk to a lot of family members, and I hear so often, I feel so alone. And with millions of people being affected by this, it's amazing that we still feel so alone. But I'm so excited to be here with you that we are not alone, far, far from it. And we do have a voice, as you say, and we do have some momentum, and there are things that we can do. I have this motto: drugs don't win, love does. And it's really getting into what is this place of love, using our own inner wisdom, our own divine guidance, and being informed and getting educated and learning new skills with tools that are effective, and combining our efforts. And it's going to take more and more people in our nation to empower this movement. So you've got some things coming up. You have the march on Friday.
And that's a perfect example of what this entire call we've been talking about. Cheryl, who I can't wait to meet and give her a big hug on Thursday. But Cheryl woke up one morning and said, enough is enough. And I feel a fire in my belly, and we're going to march on Purdue. And she started it was as simple as an idea and a thought, and picking a time and a date and a place, and starting a Facebook invite. And now it's gone viral. And she reached out to me. I'm incredibly accessible. Anybody who wants to reach out to me can reach me on Facebook, hit me up through my website, hit me up on social media. I respond to everything, try to talk to as many people as I can. But Cheryl was one of those. She said, hey, can you come? And I said, are you kidding me? I was like, yeah, of course, I'm there. I'm there. How can I help? Let's all lean into this.
Purdue.
Purdue. Yeah. And it's really kind of like that David versus Goliath story. And that's what's happening. But I mean, Cheryl is the perfect example of what can be and what you can do. She decided she had enough after Corey died, and she decided that she was going to, speak up and do something. And this is her contribution, and a powerful contribution it is. The media, harnessing the power of the media is another thing we have to do. Don't be afraid to utilize them. They yes, they're selling papers. Yes, they're they've got ads to sell and everything, but the opioid crisis is a big topic. You know, they're going to be reporting on it. We need to make sure that the right people are talking to them, not just these big pharma lobbyists and uh, uh, you know, pharmaceutical companies and opioid manufacturers and distributors. You know, get in touch with your media, become a source, you know, talk to your local reporters. There's a lot we can do. But the march is, anybody who's going to be there 9 a.m. Purdue headquarters in Stamford, Connecticut on Tresser Boulevard, join us. I'll be there. Cheryl will be there. Love to have you. And hopefully there'll be a lot more of that to come too.
Mm-hmm. And your book is coming out in a couple of weeks.
Yes, the book comes out August 28th. Yep.
I love the title, How to End the Opioid Crisis. Mm-hmm. I don't want you to divulge the whole book, but that's quite a statement, right?
Yeah. Again, I'll just say, like, we know what to do. We know how to end the crisis. I mean, I've seen it happen. It's just a matter of getting the money into the right places. Some massive system changes that need to take place, which are not, you know, unreachable. But at the heart of all of it, it requires a massive constituency to speak up and to get involved and to demand that we make these changes. Mm-hmm. We have the money, we have the resources, and we know what to do. And we also have the science and the data to back it up. Mm-hmm. So why aren't we doing it? Mm-hmm. It's because we've been silenced, and as a result of being silenced, we've been ignored.
Okay, so I heard you distinctly speak our story. Start small, go bigger if it feels comfortable. Email, sign petitions, knock on doors, write, use our media, do the marches, connect with more and more people.
And love your kid or your family member, and don't ever give up on them. I got to tell you, it is a miracle my mom didn't give up on me. She was told by every single person, including members of my own family, to just forget about it, cut me off, leave me alone. You know, it's over, done. There's no hope here. She is the only person, my mom, the only person who believed in me for a very long time. Mm-hmm. You know, the only one. She remains my biggest cheerleader today. Mm-hmm. But, you know, she kept this huge, as corny as it may sound, like this like statue thing that said believe, and she kept it on top of the TV and the mantle. And, you know, she's still working today. She worked hard to help keep me alive, but she never gave up, and she always believed. And as a result, we're a family again.
Yes. Yeah. I, through the Baum Institute Family Recovery Resources, that is our premise, is that we do not give up and we do not wait for rock bottom, that we connect and we stay loving, and we're a loving mirror, and we learn how to communicate, and we learn how to encourage and inspire, and never, ever disconnect.
That's right.
It's not, you know, this is life and death. It is more critical now, and it's not necessary this tough love. It's you know, what is tough? Love doesn't have, you know,
there's no such thing.
It doesn't have, love is love. It's not tough. It's not easy. It's just love. And so it really behooves every single family member to actually get so involved with their own recovery as a family member. I know, like you, I work so hard. It is not a natural thing for me to be peaceful and know what to do and how to do it and what to say and how to say it. It takes a lot of work, and it's worth it, because through all the storms, it works. Like your mother, not to give up and not to ignore, but to keep that connection going, that everybody has worth and value.
Important to take care of yourself too in this process. So my mom, she's good now, but like, I mean, while I was using, like there could have been some more self-care. You know, she had suffered some medical problems as a result of it, which is not unique. Mm-hmm. It's really important if your child or your loved one is out there struggling right now, that you do take care of yourself, that you do take care of your health, and that you remember that is incredibly important.
Very important. That's how we get available to help our loved ones when we are helping ourselves too. Yeah. You need to be as strong as possible. as individuals and then united together. Okay, so are just before we open it up for Q&A, is there anything else that, any links that you want to share with us?
Sure.
Like,
You can find me. So if you want to connect with me, ryanhampton.org. You can send me a message there. My email is info@ryanhampton.org. You can find me on Facebook, Ryan Hampton, Twitter @Ryan for Recovery. I'm on Instagram. Social media is great these days. And the book is called American Fix: Inside the Opioid Addiction Crisis and How to End It. It's on Amazon, Barnes and Noble, all those places. You can pre-order it now, or on the August 28th, which I cannot believe is in 2 weeks. You can find it in any bookstore.
yeah, yeah. Looking forward to that. Okay, so let's open it up for Q&A. There might be a few questions.
Sure.
Yes, and also I have a question. Is there more information regarding my organization? Yes, there is. You can go to my website, joannrichards.life, and under that there will be services, and it explains the BALM Family Recovery Comprehensive Program, which includes education, skill building, and transformation. Or just look up the BALM, BALM, Be a Loving Mirror. And you can reach me at joannrichards.life. I'm available to support any family member, complimentary conversation. I just want to do my part to really help and change the energy of this problem. So let's open it up. I'm going to unmute everybody, and then if you're on your phone, you can again use *6 to mute and unmute. Unmute all. Okay. So, who has a question? We have some comments. Congratulations, Ryan, for sure. I'm looking forward to reading your book.
I can answer anything.
Yeah, well, I have a question. Like, okay, so were you just chosen by facing addiction? Like, how did you really get started with this?
No, not at all. That's not how it went. They gave me a shot. I originally started as just like kind of a local field organizer and someone who was, basically kind of on a volunteer basis in the beginning. I kind of like forced my way in there, and they kind of nurtured me and taught me a lot and trained me a lot. It was after my buddies died. I had been working for them after my buddies died that I was just like, I've had enough. And I went out on my own and started meeting people and connecting and the whole kind of social media boom and the book and all that. It's kind of a phenomenon, but it's a lot of people. It was a common, I think what it was a very common unified message that wasn't being spoken loud enough. Mm-hmm. And we had just found a medium to talk to people where they really understood it, and connecting, and it just started building from there. But facing addiction is, really believed in me and my best friend Garrett when others didn't, and they gave us a chance, and we built from there.
Mm-hmm. Yeah, well, I love their emails, and if you're not, look up Facing Addiction. They put out a lot of petitions and information and notifications about joining in the request for legislators to take a look at really important legislation. And Ryan, do you think they actually read our emails?
Oh yeah. Yeah. They read everything. Yep.
Right. Yep. We do have another question. What's your feeling about turning an addicted person out of the home?
Well, it depends. It's really circumstantial.
Mm-hmm.
I can't, it's just very hard to say like yes or no. I would say don't turn someone away um, purely based on the addiction. But also if you have personal boundaries that are being crossed, then, you know, that's another story.
Mhm.
It really varies. You know, I mean, I think that there are ways to deal with it with empathy. Like with, I mean, all I can offer is my own personal experience. I lived with my mom on and off throughout my addiction. You know, it was really one of the only ways she knew I was safe when I was there. If I was stealing from her, that was a game changer. That was a deal breaker. Um, you know, if I was, you know, there were certain things that just I wasn't, you know, walking over her like a carpet. You know, arguments, anything physical, violent stuff like that. No, that wasn't accepted either. Um, and eventually, she did kick me out. But it depends. I mean, it depends on the age. It depends on what they're using. It depends on how far they are. It depends on if they're you know looking to get help. I mean, if you're bridging a gap, you know, there were also times when my mom knew I was going to be getting help, and she kind of you know let me stay there for a couple of days till I got help. I mean, it's very circumstantial, but I think that's more of a question for the person asking to internalize. Is it's very important that you have your own boundaries, because if you go into this with no boundaries, that's very dangerous. So I think when you have to establish kind of a space and a zone for yourself, and then it's much easier to answer that question.
Yeah, that's what we do in the Balm also, is really helping families to develop an inner sense of um, self-care, of peace, of knowing how to take care of that first, and communicating effectively. We have something called a Balm conversation, where it's a mini intervention, and there's things that you can do before this explosion of desperately needing to kick someone out of your house. So it's, what can I do prior to that to stay connected but be effective also,
It's also
and
really important
exercise
to keep
boundaries.
the boundaries, but it's important to have communication and
Mhm.
honest and open communication,
Mhm.
even if your loved one is using and they're not getting honest responses from them. It's
Mhm.
so important that you're communicating to them.
Mhm.
I think a lot of this, some of these questions and some of these blowups that happen is because loved ones are, you know, terrified. They're not communicating, and
Mhm.
you know that's a whole nother. Spend hours on that, but there is a way to do it. Sometimes for me, it was my mom and I. It was you know there were times when like I you know she couldn't talk to me. I mean, she'd open her mouth and I'd open my mouth, and
Mhm.
man, before you know it, like,
Yeah.
so we resulted to writing. You
Mhm.
know, I mean, there were a lot of times where there were notes, and you know, maybe I didn't want to hear it then, but you know, I understood the message, and she understood my message, and uh, you know, I mean, and that's what it was. But there was communication, and it was through notes.
Yeah, yeah, it's really imperative that we learn effective communication, and there are various ways to do that. And I love that you were writing.
Yeah.
It's you know, and even those, the words that we choose, and um, we have to be really careful about that. And that is how we can contribute to someone's choice to choose recovery. Always with love as a foundation. So just one more question. And as you're considering this, Ryan, if there's, you know, if you consider your parting thoughts for us, um, again, it's like, how do we support you and all those who are trying to support us, and especially if we're being silent? Um, so the last question from our group is, what was your turning point where you decided to finally give up drugging?
You know, there wasn't one point. I don't think there were multiple points that led to where I'm at today. I think when I got out of treatment, there were a lot of times when I could have decided that I mean, I had wanted to get high. You know, those first 6 to 8 months, I had thought about it a lot. But I also kept thinking to myself, what if I don't? Like, I know what's going to happen if I do, but what if I don't? What might happen when I don't? And I fought it. You know, those first 8 months were really hard. I fought it. I can tell you the shift for me, the perceptual shift, and this is going to sound crazy. It's going to sound nuts. Somebody said to me, they're like, why do you wake up in the morning, Ryan, and you don't make your bed? Like, why is your bed in the sofa? Like, why is it always messy in the morning? You know, why don't you like take out the trash? I honestly started making my bed in the morning. It was simple. I made my bed in the morning. A couple weeks later, I, you know, started making sure the house was clean in the morning before I left. A couple weeks later, you know, started talking to my mom a little bit more. A couple weeks later, I realized that I wasn't lying as much. It was a series of things. Mm-hmm. That now when I look back, it wasn't just one moment that I was like, I'm not going to use, because I wanted to use the entire time. I started making some small behavioral changes that led me to a complete shift in perception. Mm-hmm. Eventually. Mm-hmm. So it's an incremental process. Yeah. It's not going to happen overnight. Like, it's an incremental process. And it was also an incremental process in how my family responded and my mom responded. So that first year, everything was very skeptical. Like, I wanted everything back really quick, but like, everybody was very skeptical. And trust is built over time. Trust was built through actions. You know, taking small actions that made me feel better about myself led me to a point where I made the decision that I don't want to get high anymore. When you can finally weigh, and that's why we have this thing called recovery capital in recovery, for people in recovery, which is more than just your recovery program. It's the value of your relationships, your self-esteem, your self-worth, your employment. Are you an active citizen? Are you waking up in the morning? Are you making your bed? Or, you know, there's certain things. When you have more to live for, when the benefits and the pros in your life outweigh the negatives, that's when you make the decision not to use, right? Because I have so much to live for today. And yes, I could trash it all tomorrow, but the likelihood of that is very low, because we have built a life together, my family and I, and through my recovery capital, my community, that's worth living today. Yeah. It's a lot easier for me to say no today than it was 3.5 years ago, when I couldn't find a job and I had a hard time paying my rent, and I was depressed. And, you know, you've got to find something to grab a hold on and live for.
Mm-hmm. And I think as family members of people that we love.
You answered 2 of my questions.
Okay, so people are still unmuted, and that's great, but we can hear you, just so you know. You know, as family members, there are ways that we can communicate in such a way that we're actually asking thought-provoking questions, not bombarding somebody, but asking questions so that we can raise their recovery capital.
Right.
Yeah. Yep. So thank you, Ryan.
Thank you.
I can't thank you enough. Again, everybody, there's a march in Connecticut to Purdue Pharmaceutical, and Ryan's book, American Fix, is coming out on August 28th. And I'm really looking forward to all the detail in that. And keep in touch with Ryan on Facebook, on his website, ryanhampton.org. Tons of information on your website and links to so much more. And, you know, be a loving mirror. Just know that you are not helpless. You are not powerless. There is a lot that you can learn, and there's a lot that you can do through connection, through communication, through joining together. And together we are going to rise, and we are going to heal, and we are going to change this epidemic.
Yep.
Yeah.
Amen.
Yeah, amen. So go out and love and get some skill to do it, and get some support. None of us do this alone. So Thank you, Ryan.
Thank you. It was
Thank
great. I'm
everybody.
grateful for this experience, and please reach out to me, and hopefully I get to meet some of you on the journey.
And if anybody's going to start your own march, let us know.
I'm here. I'll be there. Listen,
I'll be
email
there.
me. I'll be there. I'm in. Count me in.
Thank you. Thanks, everybody, for being here. And we'll post the recording in a couple of days.
Thank you, Joanne. Thank you, everybody. Have a good night.
Ryan, good night.
Thank you, Ryan. Good
Peace.
night.
Good night.